Good morning, everyone. Today we would like to present with 5 in topic acute severe lameness. We start with signalement and client complaint. This horse names Eddie. She is thoroughbred horse in the stud farm, 9 years old with 450 kg of body weight. Client complaint is acute severe lameness and sternal recumbence all the time. History of Eddie. She is normal appetite and drink. Body condition score 7 from 9 score. She had been showing the clinical sign for 2 days. She gave birth 10 days ago and is her first parity. Every day she eats 4.5 kg concentration feed. The owner had given phenylbutazone before consulting the vet. Physical examination. Finding the horse was shipping off for limb like that. Uh, The vital sign: she has tachycardia and tachypnea, prolonged CIT, and has 10% dehydration. Lameness examination was grade 5 when palpate at the leg and joint. There are no pain, but with hoof tester, she showed pain, especially toe and quarter area. Percussion of hoof wall was also painful. CASA was normal, zero sequence and odorless vaginal discharge was noticed. This is problem list of this case. Initial assessment. We show only important problem. The first is acute severe lameness. The related system is musculoskeletal system, which may be divided into swinging and supporting lameness. In this case, is supporting lameness. Supporting is the most possible, but cause of lameness should not be the bone and the joint problem because she did not show sign of any pain when we palpate. Now, we suspect hoof problem because hoof tester and percussion test is positive, but we need lab to identify this problem. Another problem is zero sequence and odorless vaginal discharge. We think the related system is a reproductive system. We suspect two organs related. The problem include uterus and vagina, but now we need other lab to identify the cause of the problem. Part 6 is a laboratory result and interpretation. This case was recorded to lab, which were blood examination and radiographic imaging. The red cell profile is normal. Next is a table is white blood cell count and platelet smear. The abnormal results are neutrophilia with right shift. Suspect physiological or stereochem or maybe cause of infection. The eosinophilia may be a physiological response. The blood chemistry. We can see abnormal of total protein, enzyme ALP and enzyme AST. Hyperproteinemia we think is because of the dehydration. Increased ALP may be cause of bone damage and bone response of inflammation. And increased AST we suspect muscle damage. Next is a radiographic imaging result and interpretation. The lateral medial view of left forelimb, we found unparalleled hoof wall to the parietal surface of distal phalanx. The coffin bone rotated 13 degrees. Found radiolucent and under this area. Dorsal palmar view same leg as is normal. Lateral medial view of right forelimb, unparalleled, unparalleled of left leg, but it has 10 degrees of rotation. Dorsal palmar view at the same leg shows sinking at medial aspect.
Revised assessment. Laminitis has been confirmed by radiography. Zero sanguineous discharge needs further diagnosis such as ultrasonography, vaginal histology, and vaginal speculum. The final diagnosis is dorsal-capsular rotation laminitis in left forelimb and mediolateral rotation laminitis in right forelimb. There are many causes and risk factors of laminitis, but in this case of FD, at this point we suspect obesity and equine metabolic syndrome. The treatment plan for laminitis: we relieve pain with phenylbutazone and cryotherapy, and supportive with fluid therapy and food supporting, and prevention with trimming and chewing. The suggestion that we tell owner are decreased feeding, hoof trimming, and exercise restriction. But if you think it has done, you are wrong, because the real primary cause of AD is reproductive infection. The most important data that we missed and did not request was bacteria culture that's positive in E. coli and Streptococcus species. So, the appropriate treatment plans must include uterine lavage and antibiotic drug. What we learned from this case: we have to do a complete history taking and use the right tool for the right answer. And it's my reference. As last, we would like to thank PA and PK for advice along the case. Thank you for your attention.